According to WHO, 29% of all deaths in Nigeria are due to non-communicable diseases. Cardiovascular diseases account for 11% of the deaths. Prevalence of hypertension in Nigeria is about 29.5% for men and 31.1% for women. Hello, welcome to Health Matters on OSRC Television. Today on the program we'll be looking at hypertension. What is hypertension? Are there any symptoms for hypertension? And today in the studio with me I have a nurse, a nursing officer talking about Ifeoluwa Ajayi. Ifeoluwa, you're welcome to Health Matters.
Thank you very much, ma'am.
So we'll be looking at hypertension. So can you explain to our viewer out there what is hypertension?
Hypertension can also be defined as a persistent elevated blood pressure that is above 190/80. So anything that is above 190/80 is known to be what? Hypertension, or we can say the patient is hypertensive.
Okay. There is this question I would like to answer. Hypertension and blood pressure, are they the same thing?
Yes, hypertension and blood pressure, they're the same thing, ma'am.
Okay.
They are the same thing. As we have hypertension, we have hypotension.
Yeah.
We also have high blood pressure and we have low blood pressure.
Okay. Hypo is when it is down, right?
Hypo is when it is down, and hyper is when it is up.
Now we're talking about hyper now.
Yeah, we're talking about
hypertension.
hyper.
So
Yes,
what are the risk factors of is hypertension?
The risk factor of hypertension, first of all, we will subdivide it into two. We have two stages of hypertension.
Okay.
We have primary stage, we have
Okay.
secondary stage.
Okay.
Because each stage has its own risk factor for
Okay.
what? For hypertension.
Mm-hmm.
We have sedative lifestyle. The lifestyle you live determines what will happen at your old age or when you reach a age above 40 years. We have alcohol. The drinking of alcohol can also cause hypertension. We have the use of tobacco use can also cause what? Hypertension. We have family history, because when you got to discover that your father, your mother, or your great grandfather or mother is hypertensive, there are all probability that you also be hypertensive as a child.
Are you now saying it is hereditary?
Yes, it's hereditary.
Really?
Yes, hypertension is hereditary. So when you discover that, you will know that you can also be hypertensive. We also have drug.
Okay.
Drug also
Contributes to it.
Yes, drug also contributes to the side effect of drugs that we use. We don't just take drugs anyhow without medical personnel. So also cause hypertension too. We also have hormonal contraceptive pills.
Mm-hmm.
Yes, in which ladies use after sex too. Also causes what? Hypertension. We have obesity. Obesity, when somebody is fat, because people who are fat intend to be hypertensive. Yes, people who are fat.
Is it because of the heart or something?
Yes, because of the let me say adipose tissue, or the fatness also causes somebody to be hypertensive. We also have a lot of risk factors that also causes to be. We also have aging and gender too.
Okay.
Because it's more common, according to what you said now, it's most common in men.
Mm-hmm. In men than
women, because women tend to vocalize their feelings. That is why Africa has trained men to keep silence, and it's killing men. Yes.
Then why is that? Why are you men? What are you hiding?
Because they tend to believe that when you as a man, when you don't vocalize your feelings, you are not a man. But women, any small thing, they voice out. So because of that, they are not really hypertensive compared to aging too. And it's almost common in black race. When we say a black man, you know he's always hypertensive. We have different.
Okay, aging. Between what age?
Yes, from 40 upward. From 40, when you are 40, know that there are probability that you will be hypertensive. So you have to what? You have to fight for it. And when you have the right education concerning it, you will know you have to what? You have to prevent it.
Okay, now the question: how can you know if you are hypertensive? Like, as I'm sitting now, then I feel somehow. Tell me, are there any symptoms? anything that will let me know that I am actually hypertensive?
Yes, it's a very good question, ma.
Yeah.
I love that. The first thing you would know if you're hypertensive is when you have frontal headache.
Okay.
They used to say when you have frontal headache, you tend to know if you're hypertensive. When you feel dizzy, you just feel dizzy. You just feel dizzy all over your body. That shows that is one of the symptoms of hypertension. When you feel weakness in your body,
Okay.
you just feel this weakness in your body. Yes, you will know what you are. You are what you have.
Hypertensive.
Yes, you are hypertensive. Also, when you feel severe headache that is more than 3 days, and when you take your what is called it, your analgesic, and you discover that the headache is still persist, you have to reach out to a medical officer, a registered nurse, a professional registered nurse.
Okay,
So
a doctor.
yes, or a doctor, for you to know if you are hypertensive or not. So we have different kinds of symptoms in which you're going to know if you're hypertensive.
So if you notice that you're hypertensive, how can I manage it? How do I manage hypertension?
Yes, that's the
Okay,
first.
you've been diagnosed of being an hypertensive patient, right? How can I manage it? I want to live. Yes, I am hypertensive. So let's listen to you.
So the first thing for you to manage such diseases, I first tell my patients that hypertension is a life medical disease. It's not like maybe you have it, it's curable, it's manageable.
I also learned it is a silent killer.
Yes, it's a silent killer.
Yeah.
It's manageable. So the first thing is, we will train you as a medical person, as a registered nurse. We're going to train you how to monitor your blood pressure.
Okay.
Yes. Strictly, we are going to place you on observation.
Okay.
Observation means you'll be monitoring your blood pressure every 15 to 10 minutes, especially if it's hypertensive crisis. When we will place you on drug, we have different kinds of drug for that, in which we will place the patient, in which you'll be using subsequency. You'll be using every day. So apart from that, we also have different types of ways in which you can use to manage a patient who is hypertensive.
Okay.
But it depends on the condition of the patient. So as we have primary, we also have secondary. The way we treat primary hypertension is different from the way we treat secondary hypertension. Because primary hypertension, we can ask you to go home and ask you to take this drug. You have to buy, they call something digital sphygmanometer, like in which it's a cup you put on your hand for you to check your blood pressure. Sure, you get. And when we discover that the blood pressure is above normal, then we'll ask you to come down to the doctor for review.
Then how often can one check?
Place the patient on appointment.
Okay.
Yes, we'll give the patient appointment date for you to check. Maybe it's every Monday, maybe every 2 weeks, or it depends on the condition of the patient.
Can it be done on your own? Like we have some hypertension kits too that we can use manually at home.
Yes.
Can you do it allowed?
Yes. But when a patient has underlying condition, do you know we also have different underlying condition? Like we can have a patient who have diabetic mellitus and also have hypertension with it. So when it is only hypertension, we can ask the patient to go.
All right. Right now we'll be going on a short break and we'll be back shortly. You're welcome back to Health Matters, our health program on OSRC television. Before the break, we were talking about hypertension. We talked about how well you can check. How often do you check when you are hypertensive? So we have a nurse in the house, in the studios with me, Ifeoluwa Ajayi. Now, before the break, I asked about how often one can check your BP. So let's hear you.
So often you can check your BP every day.
Okay.
So I told you earlier that it depends on the condition of the patient. We can place the patient 30 minutes. We can place the patient 45 minutes. But checking your blood pressure daily, it's okay.
Daily.
At least daily.
That is
every day.
Every day. So if you have an appointment in the hospital, does that mean you have to visit the hospital every day, or when you are on admission?
I told you that it depends on the condition of the patient. If it's hypertension crisis, we have to admit the patient.
Okay.
Or if it's secondary stage of hypertension, we have to admit the patient.
Explain the secondary stage. Let's talk about it.
The secondary stage of hypertension, I told you earlier that when you have the underlying disease condition, when you have inflammation of the pancreas,
okay,
automatically you'll be hypertensive. We have
diabetes.
Yes, diabetic mellitus.
Yeah.
Diabetic mellitus also cause secondary stage of hypertension. Diabetic mellitus and hypertension, they're like brothers. So it depends on the depends on the disease condition that can warrant secondary stage of hypertension.
Okay. Now, who is more likely to have hypertension? Nowadays we have under 40, 30. They will tell you, let that person go and check. He or she is hypertensive. So who is more likely to have hypertension?
Everybody.
In those days it used to be the aged,
yes, but
now it's cut across board. So who is more likely to have hypertension?
Yeah, people who are intense, people between 25 upwards can have.
Really?
Yes. But we are too stressed in Nigeria. Very, very
stress could be another problem.
Yes, I said it earlier that one of the risk factor of hypertension is. So I advise my patient to rest. Okay. Keep yourself calm. The first question I'm going to ask, Mommy, what are you thinking? Because what you are thinking can cause hypertension. So you have to rest. Okay. And when you rest adequately by sleeping adequately, having your rest time is very, very important.
Okay.
No matter what you are passing through, because of your health, you have to have an adequate rest.
Okay.
It's very, very important. And sometimes water also helps too.
Water?
Yes.
Okay. How?
Yes, water helps in the sense that when you drink adequate water, it will put your body into rest.
Okay.
So that is it. So, but any age can have it. Some people above 25 upward can have it, but mostly when it is 40 years, there are a lot of predisposing factors that can warrant you to be hypertensive.
Yes, let me bring you back a little. In Africa, we believe that maybe when you are stressed, you'll be hypertensive, or maybe your mind. Whenever if you tell anybody that I've been diagnosed with hypertension, you say, what are you thinking? What is it? Are you owing people? Would that be the main reason of people having hypertension?
No, that's not the main reason for people having hypertension. We have body physiology.
Okay.
The ways our body functions differs from each other. What your body can accept differs from what my body can accept. What my body can accept differs from what your body can accept. So our body physiology differs from each other. Our stress let me use the word stress threshold differs from each other. Something can happen, a stress can happen to me, and I have the capacity to withstand. That same stress can happen to you. I pray it will not happen, but it can happen to you, and immediately things can stop. Or things can open. So our body physiology differs from each other. Okay. So that's it.
So our diet, does it have anything to do with being hypertensive? Let's talk about the diet.
Yes. Our diet cause also one of the predisposing factor for someone who is predisposing factor that can lead to hypertension, especially taking of high sodium salt. The salt we take at home,
too much of it,
yes, causes hypertension. Like when you are 40 and above, there's no point taking salt. You can reduce your salt. I even advise there's no point. If you know there's a must to put salt in whatever you want to take, you can put it, but a very low quantity. Also, saturated fats,
Yeah.
like all these high cholesterol, taking of vegetable oils can also cause hypertension. So vegetable oils that have high cholesterol can also causes hypertension. So balanced diet, eating of fruits, vegetables, this has been the standard way of eating, and reducing carbohydrates.
Okay.
When there is carbohydrate, when the carbohydrate is being reduced, can cause
But here in Nigeria, in Africa, most of our foods, they are carbohydrates. You want to take a bath, carbohydrates. You want to eat yam. You want to drink gari. You want to. So, what can we really do? What do you think? Maybe
that's the
proteinous food.
Yes, proteinous food.
Okay,
yes.
then fruits.
Yes, fruits.
Vegetables.
Yes, and oil and minerals.
Okay.
Can also the nature or medically, we have a standard way of living. So balanced diet is a must. A must.
It's a must.
Must
Balanced
follow
diet.
that principle of balanced diet. At least if you are taking carbohydrate, know that protein should be the next. Should be the next day. Maybe prevention. You when there's carbohydrate, you take carbohydrate in the following day too. You can also take protein. You can just substitute and balance everything.
Okay.
With wisdom.
We already talked about who are at risk of having hypertension.
Yes.
Let's talk about pregnant women. Are they also, can they be hypertensive?
Yes, we have pregnancy. We have hypertension in pregnancy.
Okay.
Yes, the pregnant women immediately get pregnant. Their hypertension and they are hypertensive. Their blood pressure rise. So we have pregnant women who are
How can that be managed?
hypertensive. They will place them on drug.
Okay.
And
As between how many months from?
within that 9 months.
Okay.
So, but when they deliver their baby, the blood pressure will come to normal.
Okay.
So there are women like that.
Okay.
Who
What
are
about the
hypertensive.
aged?
The aged,
Yeah.
yes, the aged also. I told you earlier that anything 40, 60 above have the predisposing factor to be hypertensive.
Is it because okay, let's say maybe when you are obese too,
Obese,
you immediately you see an obese person, you say this person will be hypertensive.
there are probability that they will be hypertensive.
Really?
Yes.
How can you tell us the relationship between the heart, when you have a heart problem and you are hypertensive? I think they are interwoven somehow.
And they are interwoven somehow.
So can you explain that?
About the heart, actually, when you are hypertensive, you intend to increase your heart, they call something cardiac workload of the heart.
Okay.
So you intend to overstress it.
Okay.
So that is why we place patient on adequate rest. We admit the patient. We will make sure that the patient does not have any form of disturbance. Avoid noisy environment. We will restrict their relatives to come and visit them.
Okay.
Apart from that, again, I will place the patient on a comfortable bed.
Okay.
And we'll monitor the patient every 5 to 15 minutes. I told you earlier, it depends on the situation that warrants the patient who is hypertensive. So that is it.
Another thing, hypertension, can it lead to stroke?
Yes.
And please explain how.
Yes. Hypertension.
Then to what level? You understand? Maybe when you are fully, by the time you check your blood pressure, then you notice that something is high. So can it lead to stroke?
Yes, because when your blood pressure start entering 160, 100, it can lead to stroke, especially if the patient faints.
Okay.
And we are trying to resuscitate the patient back to life. Can paralyze the lower limb and the upper limb. I mean, lower limb means your left leg and your right leg. So it can paralyze it. So better still, hypertensive is a silent killer. It's not something you joke with. So it leads to stroke.
Stroke.
Definitely.
So now let's talk about the treatment. What treatment do you think are available for patients with hypertension?
Yes, we have different kinds of
Treatments,
drugs. Yes, for patients with hypertension. We have nifedipine, amlodipine, metidopa. Depends on the. But I will advise my patient to see a professional medical personnel. You don't just take drugs anyhow. So we will prescribe drug for you after strict past and present medical history. When we have checked we have questioned you about your past medical history, your present medical history. We have placed you on observation. We have do some primary medical checkup. Then we
place that person on a drug.
Yes, we place the patient on a drug.
Like patient A and patient B. You are used to a particular drug.
Yes, ma'am.
Then you notice that patient B has hypertension. What works for A, can it work for B?
No.
I'm talking about the drugs now.
Yes, it might not work for B.
Okay, so the best thing is to see a physician.
Yes.
Okay.
Medical personnel.
Okay.
For further medical attention.
So what is the normal blood pressure?
Yes, normal blood pressure is 120, 80. Anything
Yes.
110. 110, 80. I mean, we have systolic, we have diastolic.
Diastolic.
We have systolic, we have diastolic.
Okay.
So anything 110.
Systolic is the high.
Yes, systolic is the high, diastolic is the lower.
Okay.
Yeah, good. I like it.
Thank you. Now, what are the conditions related to hypertension? I'm talking about any other ailments that is related to it that can lead to hypertension.
Yes, I said.
We talked about diabetes the other time.
Yes.
I think there are more.
Yes, we have.
Avoid this so that you not be hypertensive.
Yes,
that's what I mean.
Are you talking about the disease condition
yes.
that can warrant? Okay, we have renal failure.
Okay, which one is that?
Renal failure is when your kidney is manufacturing. Yes, malfunctioning. I mean.
Yeah.
We have though hypertension can lead to retinal damage, the your visual sight actually can also lead to it too. We have cardiovascular accident too. So, but especially this renal damage, I mean manufacturing of the kidney leads to, and we have inflammation of the pancreas too.
Okay.
Yes, inflammation of the pancreas too also leads to hypertension. So we have.
Thank you very much, Nurse Ifeoluwa Ajayi. On the final note, any advice for an hypertensive patient? Instead of majority of us believe in self-medication, that immediately you feel that you are hypertensive, let me go and take this drug, let me go and do this. Any advice for such people?
Advice for people out there is that when you experience all these signs and symptoms that I've mentioned earlier, go to the hospital. Doctors and nurses, they are friendly. We will treat you well, especially when you meet me in the ward. I'm always friendly, smiling, so you're able to tell me your medical history. So and secondly is when you experience a frontal ache, that's the most common one, a frontal ache or maybe a stress that is beyond, and you have taken analgesic drug. Analgesic drug means paracetamol, diclofenac. You have taken it and you discover that it still persists. Go to the hospital.
Thank you very much, Nurse Ifeoluwa Ajayi, for coming. My dear brother, this is where we shall be drawing the curtain today on this week edition of Health Matters, our health program on SRC television. You have heard it all. Our topic of discussion today is hypertension. We've talked about how well you can cure it, how to avoid. There are some certain foods that you need to avoid and remember, health is wealth. Until next week when I'll be coming your way again, I say bye for now and take good care of your health, because health is wealth.